take it from the hush that people are ready for us to start. So let's get going. Welcome everybody to the Merton CCG AGM. We have an exciting agenda for you, which I will go through with you very shortly. But before I do, just a few housekeeping announcements. So we're not expecting a fire alarm. If you do hear the fire alarm go off, there are a number of different fire exits. So there's one there, one at the back, and one just there on this side. So plenty of exits if you hear the fire alarm. Please do turn off your mobile phones for the duration of the AGM. We are recording the AGM using the camera at the back, and so it would be really helpful if we didn't have phones going off to interrupt that. And then the final thing is we've got an hour scheduled for the meeting. We're planning on spending 40 minutes talking through various presentations, and then we're going to leave plenty of time, so about 20 minutes at the end for questions and answers. So what I would ask is that no matter how much you want to jump in at particular agenda items, we will take all the presentations and then we'll leave plenty of time at the end for questions. So do store them up and we'll try and take them all. So this is the agenda for today. We have, first of all, a review of the year and a summary of what some of our future plans are. Then we're going to go through the finances and annual accounts for the 18-19 financial year, which is the one that's finished in April this year. I'm then going to talk to you about the children and young people's mental health work that we're doing across South West London, but particularly how that relates to the work we're doing in Merton. And I'll give you a bit more information about the projects in Merton we're doing with our schools. And then we're going to hear about social prescribing. So we are really one of the best places in the country for social prescribing, and I'm really delighted we've got Mohan here to talk to you about that, and I think he's going to show you a short video as well. And then it is on to the question and answer session. So I think it'll be really interesting. Do hold your thoughts and questions till the end, and we'll try and take as many as we possibly can.
Okay, so I'm Sarah Blow. I'm the Accountable Officer for Merton CCG, and I am, if I can get this thing to work. How do I work this? Okay, you're in charge, James. Well done. So what do we do as a CCG? Well, we are here to, we're responsible for the planning and the buying of local services, and we monitor those and we make sure that we have high quality services for our local populations. And those are things like the hospital care that people receive through outpatients when you go in for an elective operation on your hip or your knee, something like that. The things that we don't commission are things like very specialised care, and those are commissioned by NHS England, who are a partner organisation of ours, and we work very closely with them. We also commission primary care services, and we work very closely with local authorities and the voluntary sector to make sure that we have sort of rounded services that can be achieve really good outcomes for our local patients. Okay, so ultimately what we want is high quality care. We want to have good outcomes for our local residents, and we want to make sure we look at things like reducing inequalities across Merton to make sure that those that are in the greatest need actually receive the kind of levels of support and care that they need. We want to make sure we are listening to our local populations and acting on what they say to us. And we also want to make sure that the services that we do commission are of the highest quality. So we keep an eye on what they're delivering around performance standards, which are set by the NHS, but also making the best use of our resources. We have limited funding. We have an annual account, which James will talk you through, and we need to make sure that we get the best value for the money that we get. Do you want to? Thank you. So, just a couple of highlights from this year. So I'm not going to talk a lot about children, young people, mental health, because Dr. Murray will talk about that in detail, because we've been doing a lot of work in South West London. But there is a specific area that is Merton-based, and it's called Off the Record, and it's a service that allows young people to access emotional support directly or through a referral. And I'm not going to, and they can get some face-to-face counselling and also, I think, online services as well. But I'm not going to talk any more about children and young people because there's a because Andrew will talk about that. Merton Uplift is a new service for adults. It's a service that was taken over by South West London and St George's Mental Health Trust. Get that right. And they are delivering things like talking therapies. They're delivering some wellbeing support. They're giving mental health assessments for those that need it, and a primary care recovery service. And that's an improvement on the previous services that we had in Merton, where we did have some significant concerns about the performance, but we're now building that up, and it's a much better service for our local residents. We're also looking at extra support for care homes, and that's looking at things like care planning for those that are reaching the end of life or those that might need some extra support. And we're working with Battersea Healthcare, which is part of our GP population, and Merton Health, who are working on behalf of the CCG to analyse what's actually needed and to work with the residents to come up with some high quality proposals around how we might work with care homes in the future, because we want to support people to die in the right place to get the best level of care when they're out in the community. So we're putting some additional investment into the areas that have been identified, including things like advanced nurse practitioners working with community teams. We're also looking at things like dietary supplements, and how do we work with care homes to make sure that those are being delivered and are the right kind of treatment for residents. So those are three of the areas that we're working on, and I'm now going to pass over to James.
Thank you very much. So my name's James Blythe. I'm Managing Director of Merton CCG. I want to talk to you a little bit about how we performed against some of the key national performance standards that the NHS is held to account to, and also talk a little bit about our partnership with other organisations in Merton and how we are working together across a number of sectors to improve services for local people. So the slide just talks you through some of our key performance standards. These are set out in more detail in both the summary and the full version of our annual report. I think what you'll see is a positive picture with respect to a number of national performance standards. So around cancer, around people both getting in to see a cancer specialist when a GP has a cause for concern. We're doing well around that. We're also doing well about getting people to start their first definitive treatment. And that's a really complex area that requires pathway work. So making sure that patients can access services in a really seamless way between primary care, between our local hospitals, and between our local hospitals and more specialist hospitals that contain some of the more specialised cancer services as well. We also do well for access to routine diagnostic tests outside of cancer, and also we do well around standards of ambulance conveyance time or ambulance response time to emergencies. There are a couple of areas where we're not currently meeting NHS constitutional standards. One of those is around A&E. So the constitutional standard for the NHS remains that 95% of patients are seen and treated and either admitted or discharged within 4 hours. And currently our performance for this year was 84%. And that really reflects the growing complexity and the challenges that urgent care systems face. We work really closely with St Helier and with St George's hospitals to make sure that we're doing everything possible to make sure that patients have a positive experience in A&E, that patients are given appropriate and high quality care, but also it's not just about the A&E, it's about the community and the social care system and the whole system of support around people when they are ill. Sarah referenced our change to a Merton Uplift service, and one of the areas that we're looking to improve through that service is the percentage of people who are in our psychological therapies who move to recovery. It was 46.5% last year. Although it changes from month to month, we're generally seeing higher rates of recovery in 2019-20. The slide also mentions referral to treatment times. Now these are our elective waiting times. Many of you who have been here in previous years know that we haven't been fully reporting these because St George's were not able to report their data. We got to a position towards the end of the year that St George's were able to report their data again. So we've now got all of our trusts reporting their waiting time data. And particularly at St George's, we now see a rapidly improving position in terms of the number of people waiting 18 weeks. And that has come down very significantly since they started to report again. But these are performance standards and constitutional standards for the NHS. And we know that the challenges that face people who are accessing health and care services are not just challenges for us as commissioners and for NHS providers. Actually, people are complex, and people who have healthcare needs also have social care needs. They're part of communities. They engage with local voluntary sector organisations. And we've created a programme called Merton Health and Care Together. I've talked about this at previous AGMs, so this is us coming together with the council, with local NHS providers, and with local voluntary sector organisations to look at how we can work together to improve services for local people and how we can make sure that the experience of health and care services is really joined up. We held an event last November. It was attended by a huge number of people to help explore what some of the priorities for that programme should be. And we've turned those priorities into our local health and care plan. Now, there are local health and care plans in each of the 6 South West London boroughs, and brought together, they will come together to inform our 5-year strategy. But our Merton Health and Care Plan is about priorities that local people have identified. It's based on the evidence that we have from our public health teams that support us in Merton, and it's also based on what local people have said to us about how they experience services at the moment. And some of the themes coming out of that local health and care plan, we've divided it into start well, live well and age well to represent the 3 phases of life. And there are themes around children and young people's mental health, which you might have realised by now is something that we spend a lot of time focusing on, but also for children about the transition into adulthood where children are receiving support, which is such an important area and something that we're working on very closely with the council. Under the Live Well theme, you may be aware that the council and the CCG have had a focus for some time around diabetes and how we both improve support for people who have diabetes, but also work together across public bodies and with communities to prevent diabetes and to support people to live healthier lives. Because we know that diabetes is something that can be very debilitating. It can really affect people's ability to live well and have a healthy and fulfilling life. And it also places a huge pressure on services. So that's something that we're tackling across the system. Social prescribing is also one of our key priorities because we know that across the whole community that can support people who have really complex needs. And finally, in the Age Well theme, our focus is really around integration. We work very closely with our council colleagues, and one of the really strong elements of the last couple of years for me has been how we've worked really closely with social care in order to make sure that people are supported in a seamless way, whether they are coming out of hospital or whether they just have worsening health and social care needs. And through an initiative called Integrated Locality Teams, we're supporting people who are at risk of hospital admission much better together. And also, Sarah referenced our Enhanced Health and Care Homes work, which is looking to support people in care home settings. So that integration, that bringing together of health and social care so that we support people in a really joined up way is also a key focus of Merton Health and Care Together. And our draft local health and care plan and the work that we've been doing subsequently is continuing that work and will be a key part of what we do going forwards.
Okay, so I'm going to talk to you a little bit about some of the work that we're doing a bit wider than Merton. So we work together across South West London on a number of pieces of work, but also for those of you that aren't aware, I'm accountable officer for 5 of the CCGs across South West London, as is James, and James Blythe works across 2 CCGs. So we work together because we're stronger together and because we believe we can get better outcomes and invest our resources better by working sometimes at scale as well as working very locally. So the 6 CCGs in South West London agreed in April that they would move together towards a merger and for April next year. And whilst retaining the really, really good work that we're doing around things like Merton Health and Care Together and ensuring that we keep as much as we can locally and doing the right things locally. So we will be putting an application in September. We'll be signing that off at the end of September with all of the governing bodies. And what that will allow us to do is to put some of the money that we have to save from management costs back into the front line and still retain a really local focus through our teams without having to reduce too many frontline staff, but actually taking the money out of things like some of the back office and the administrative functions. So we have been talking about this in our governing bodies over the last few months. The proposal will go forward in September if we have agreement of both the governing bodies and our memberships. And we are talking to local people, to our partners and to others about how we do that. So that's a piece of work that's happening now. Can you move the thing forward? And the final thing I'm going to talk to you about, which many of you will be aware of, is the Improving Healthcare Together programme. And now this programme we're doing jointly with Merton, Sutton and Surrey Downs CCG. And what we're doing is working with Epsom and St Helier Hospital because they face significant challenges. We've known for many years, actually, that they are struggling with the estate that they have, with the staffing that they have, and there is a financial problem within that trust. So we are working together, and we have been working over a long period of time to develop a case for change and a new model of care, which has come together in a draft pre-consultation business case. Now, we've made no decisions. What we have done is we've submitted that draft up to our regulators, and what we are going to be doing now is waiting to hear from the regulators whether or not they think that we may have a good opportunity of having some money to invest into buildings, infrastructure and new services for our area. If we get that, and they positively tell us that we can progress, we will consult with the general public. So we will come out and do a big consultation with the members of the public before we make a decision. When we have all the information back from the public, the three governing bodies will come together and make a decision about the future of those services. We're not there yet. We're still waiting for more information from the regulators. And in the meantime, we are still carrying on doing work, and every bit of feedback that we receive on the work that we've done so far, we take that into account. So it's just giving you a bit of an update. James is now going to come and talk about money. Other James.
Right, so a couple of slides, brief slides on money. The first thing, as Sarah said, is we receive money to buy services on behalf of the residents of Merton. We get funded on a national formula, so all CCGs across the country operate under the same formula. And we're then effectively given a budget of which we have to work to. So for last year, that was about 285 million. We don't employ doctors, nurses, we just buy services and commission services off people. And that slide there shows you roughly where we spend our money. So 50% of our money goes into hospital services. So that's when you turn up for A&E or you get admitted to hospital or an outpatient, it's those sorts of services. 26% goes on mental health and community services. 20% goes into primary care, which will cover the cost of funding GPs in their practices and also prescribing costs as well. So when you get a prescription written out and there's a cost to the government for that, that will come out of that. And then there's 3% for corporate costs, which will include some of the management costs that Sarah's just been talking about, but will also include some of the programme costs, as we call them, which is where we're funding development opportunities and we're trying to pump prime some things. So that's roughly where we spend our money. We have a few financial targets to hit. As I said, we get a set amount of money. We're only allowed to spend as much as we receive. I have to go to places if we end up spending more than we're allowed to. I'm pleased to say that we didn't do that in Merton this year. We hit our financial targets, so we've maintained that tick of financial stability. We also have to get an external review of how we've spent our money. So our external auditors take a value for money test, as they call it, which is really just saying, have we made fair and effective use of our resources? One that's come in the last couple of years, there's a big drive, as you know, to invest in mental health services, and Andrew will talk about that in a little while locally. We now get audited, so we're told how much extra we have to invest as a minimum each year for mental health services, so we have to get audited on that, and again, we've got a tick for that. And again, if you remember that slide on corporate costs, there's a limit on how much we can spend on that, so we set a budget, a specific allocation for running costs, and we're not allowed to exceed that, and we haven't exceeded that. So we've ticked all our financial target boxes this year. Oops, sorry, I've missed that one. I'll show you the ticks anyway.
Thank you very much, James. So I'm going to talk to you now, not specifically in my Merton CCG chair role, but really in my role as the clinical lead for children and young people's mental health across South West London, and particularly then telling you what that means for Merton. So it's a really exciting story. We started about 18 months ago with the problem of self-harm in our young people, and we're seeing a rising instance of self-harm in young people, particularly teenage girls. And it was pretty shocking, actually, when you look at the data across the country and what we're seeing in South West London. We knew we had to do something about it. We got a group together across the system in South West London, so health commissioners, health service providers, people from local authorities, people from the voluntary sector, teachers, and children and young people themselves. And we got together and we said, if the problem we're seeing is a rising instance of self-harm and more kids ending up in A&E having harmed themselves, what is the cause of that, and what do we need to do about it if we're really going to make a difference? So we realised that what we needed to do was really start to invest in emotional well-being and resilience in our young people at a much earlier stage, way before they get to the point where they need specialist mental health services, but rather to try and do it at a younger age and at a much earlier stage of their mental health journey. And we also realised that we needed to do it in a school context because young people spend so much of their time in school. So the strategy that we landed on was a whole school approach. And we started off doing this piece of work before we had any guarantee of external funding. We committed to doing it because we thought it was the right thing to do. As it happens, it was a really opportune time to be setting that as a priority and to be doing that piece of work, because fairly soon after we had decided to do that and we'd committed to do that, there became the opportunity through the Green Paper on children and young people's mental health to bid for national funding as part of the Trailblazers across the country, which was about starting to experiment and pilot an approach to improve children and young people's mental health and to start to show that we really could make a difference by doing something different. So we agreed on the whole school approach. Across Merton, Sutton and Wandsworth, we got national funding to be trailblazers. So Merton is a national trailblazer for children and young people's mental health, and that is particularly focused on the whole school approach. And I'm going to, there's a slide here, it's got quite a bit of text on. You'll have it in your packs. What I'm actually going to skip to is to the slide that shows you what a whole school approach is. So in Merton, we have a cluster of schools who are committed to doing this. We have a school that's leading that programme. So the head teacher from Ursuline School is bringing together those schools, working with the head teachers who are all committed to delivering a whole school approach in their schools. The first thing you will see at the top of the diagram is a whole school policy. So the key thing really is that the schools have to set the right ethos and environment, and it's actually been a really big part of the programme, is schools having conversations about the problem they're experiencing with their young people and what they can do about it. And for me, one of the most exciting things is some of the things that have come out of that. So stuff that we hadn't planned, because the schools have started to take this problem seriously and to talk about it internally, they've come up with their own ideas. So we're seeing schools putting on yoga classes in secondary school, investing in mindfulness, all sorts of things to support their young people beyond what we'd actually envisaged when we set up the programme. If we go round clockwise, another big part of the programme is actually supporting schools with their curriculum, teaching and learning. So we're providing resources to be used in PHSE lessons. We have just launched a directory of services so that teachers and young people know what sort of services they can access in their area. I don't just mean mental health services, I mean youth clubs and all sorts of things that actually can promote resilience and emotional well-being before they get to the point of being mentally ill. The other thing we commissioned as part of that was online peer support and online counselling support, which is the one down. And as part of that, we actually went into schools and we got them to make a decision on who they wanted to provide the service. And that was a really great bit of commissioning. We asked them to test it, and they actually were, I think, a bit better than our commissioners sometimes at asking pertinent questions and trying to work out whether it would work for them in real life. So we're really pleased that we've launched Couth, which is online counselling for young people. And that was really because young people chose that as the thing they thought would work best for them. A big part of the investment, so through the Trailblazer, we got a lot of extra money into the system to support the programme. A lot of that money is being spent on creating the mental health support teams. So each of the school clusters has a senior clinical psychologist and a more junior clinical psychologist to support the teachers and the schools in delivering the approach, but also to set up group counselling sessions and to provide some one-to-one support. But as part of the programme, each cluster of schools also gets more junior psychologists who are called educational wellbeing practitioners to work with the schools, and they get provided through Health Education England. They're graduates, they actually learn on the job. So we know there's an issue with supply of health workers, so part of the solution is to get people fresh, get them into the schools, learning on the job and very quickly starting to interact with the pupils and deliver interventions as quickly as they can. We've been really successful in that, and they're already starting to deliver some interventions with the young people in schools, which is great news. Carrying on round clockwise, so the next thing you can see is parenting classes. So there's a great programme run by the Maudsley Hospital called Empowering Parents, Empowering Communities. And that is a programme where parents get trained how to recognise mental ill health and how to support children and young people who they encounter, be that their own or other young people they come across with mental ill health. So learning how to support them. And it's a train-the-trainer model. It's got a really good evidence base. We know it's effective, and we are funding that across all the cluster schools, and that's going to launch very shortly this year. We're, as part of the Trailblazer, and we were planning on doing it anyway, we're evaluating the programme. So we're working with the Anna Freud Centre and specifically Cork to do an evaluation looking at the baseline levels of mental wellbeing in the schools in years 5 and 8. And we're going to repeat that after a year to show that the interventions we've put in place have made a difference. And that's so that we can build a business case so that we can cover every single child in South West London. And you will see in the subsequent slide we're already well on the way to that. We've done a lot of engagement. I talked about the engagement as part of the procurement for Couth. We've also been engaging with children and young people recently to try and understand what language they use when they talk about mental health. So when we're communicating with them, we can talk in language that means something to them. So we've done a piece of work to look at language and to look at what sort of images work. And that has meant that we have been able to create some marketing material for the Couth service. And it's tailored both to secondary schools and primary schools because actually they want different imaging and messaging. And that's what we learned through that engagement work. So we're really confident now that when we have a great product that we want to make available to young people, we know how to tell them about it. And that's just a good example of the engagement work that our South West London team has been doing on our behalf. The final thing I wanted to talk about, which is the top left in about the 11 o'clock position, is the work we've been doing with staff. So interestingly, engaging with schools, the teachers often tell us that they feel really ill-equipped to deal with mental ill health in their schools, and they have really appreciated being given support. We've been able to roll out mental health first aid training to all the teachers in the cluster schools, and they've found it incredibly valuable. It teaches them how to recognise and talk about mental health in schools, how to deal with issues when they arise from their pupils, and the feedback we've had has been incredibly positive. We're also committed to supporting the mental health of teachers themselves, because we know that unless they're mentally well, it's very difficult for them to provide the support that young people need. So that gives you a summary of what we're doing in terms of a whole school approach. We've got 16 schools in Merton in the cluster. Going on then to the next phase. So in the initial round of Trailblazer funding, we got 1.85 million of funding. We've just been successful in another 7 Trailblazers across South West London. So that's another £4.5 million of NHS funding that we're bringing into South West London to support 7 Trailblazer sites, Two of those apply to Merton because one of them is focused on children with special educational needs, and that is across Sutton and Merton. So there's a number of Merton schools that are going to be served by that. The other project, the other Trailblazer project that touches Merton is the one focused on further education colleges. So we've got funding to do work on a whole college approach to mental wellbeing across South West London, and we're going to be working very closely with South Thames College, who have a presence in Merton, and that's going to benefit some of our older young people. And in fact, only ourselves and Leeds across the country have Trailblazers focused on further education. They've done some work in Manchester outside of the Trailblazer programme, but we're actually starting to share information across those three areas and really starting to explore what it means to support some of our older young people. So I just wanted to share that with you because I think it's a really good example of what we've been doing and how, I mean, going back to the moving forward together conversation, how when we do work together across South West London, we can do stuff on a slightly better scale, and it gives us the opportunity to attract significant funding in that we would not have otherwise got. So I will now hand over to Mohan, who's going to talk about another great project, which is social prescribing.
Hi everyone, my name is Mohan Tukar. I'm a GP in Merton. I'm also the clinical lead for social prescribing. And I want to update you on what's been happening with social prescribing. I've been really excited the last year. We've had some fantastic results. Is everyone here aware of what social prescribing is? Everyone up to date? Yeah. So effectively you're identifying patients who have a non-medical need and utilising resources which are able to fit that demand. Often these patients come to general practice and we often medicalise the problem rather than actually targeting the root cause. We started off as a pilot in East Merton with 2 practices, then we went to 4 practices, then 9, and now we're in 13 practices in Merton. And as a result, we got these results up here. So we had 77% improvement in wellbeing scores. We also had 33% reduction in GP appointments and also 50% in A&E attendances. So some real significant statistically results there. As a result of this, social prescribing has been rolled out across the whole of Merton and is also part of the long-term plan for the whole of the UK. And by the end of 2021, NHS has pledged to have a social prescriber in every sort of network across the UK. And everyone's been looking at the Merton model and looking at our results. I've got an example here of some of the events we've been invited to go and present at. The top one, actually, we're runners-up in the HSJ Awards, and we're also runners-up in the National Social Prescribing Awards, which to highlight just how well the team has been doing on that, and also with work with the voluntary sector. There's a picture of Ray at the bottom at the National Link Worker Association talking again about the link work and how vital that role is. And so everyone is asking for what we're doing, what is special about Merton, why are you getting those results, how are you getting those results. And there we are presenting at the FAB Awards also. It's also been recognised that social prescribing is identifying patients with a non-medical need and utilising the community resource. And actually, 2 of the things we found were challenges were support for the social prescriber. And I'm pleased to announce that actually later this month, we're going to be recruiting for another 6 social prescribers with a manager overseeing them. And the other thing we had challenges with was support for the voluntary sector, and so identifying a mechanism so we can help support them. We came up with this slogan, don't medicalise, socialise, and we've got t-shirts and jumpers and mugs, so if you want to get one, go to don'tmedicalise.com. Any sort of profits go back into the voluntary sector, but it's really exciting stuff in terms of how we can help support the community and identify where the needs are. And I'd like to share with you a video which we've done this year, which really highlights a patient's journey through the social prescribing and also what the social prescriber, what the link worker does in their role.
I've been looking after my nan for the last 6 years, and the last 3.5 years she's been diagnosed with dementia. I wasn't in a good place. I was literally on the verge of crying at every single encounter with anybody, and I'd started to resent going over to look after my nan.
Social prescribing is identifying patients who have a non-medical need and matching them to the community who have a non-medical support to be able to help with this demand. Health and well-being of patients has many factors which affect it, and these social factors, if we don't identify them or rectify them early on, they would get worse and worse and they manifest as physical symptoms. What social prescribing allows is identifying this root cause problem and getting a social prescriber to really tackle or identify this problem and help come up with a sensible solution, or a solution which is sustainable for that individual.
The first time I went to see the GP, as soon as I got into his room, I just bawled my eyes out and said I couldn't cope. And he just said, well, do you want to take medication? And I said, no. He said, okay, let's go for having some time off of work. And then he made an appointment for me to go and see Adriana.
When I saw Kelly, she said that she hadn't been working. I then said, okay, let me refer you to a new therapy service that's available in Merton.
For all my life, I find it hard to talk to people and trust people. So obviously talking to a professional, obviously let out a few things, and yeah, it was weights off my shoulders.
I also signposted her to the social services to help get her Nana needs assessment, as she had said her Nan hadn't been reviewed for quite some time.
Where you're overloaded with things and you don't know how to deal with them, it's an outside perspective but also friendly.
A part of what my role is to meet up with local community services, voluntary organisations, to build a better joint working relationship so that we all feel comfortable with referring into them and signposting to these services.
Kelly came along to my dementia cafe, the Clover Cafe. When I first met her, she was so full of energy and positivity and laughing and a very happy person to meet. But as soon as she started talking about the kind of things that she was going through, I realised how much courage and effort it was taking to put on that cheerful front.
It's fantastic. We go there, she has a bit of lunch, she talks to other dementia sufferers. They also do a carer section where your carers can go off and just have a general conversation and help you talk about what's going on with the people that you're looking after, but also to give ideas.
For a lot of carers, they get offered a peer support group, but they literally cannot leave the person they're caring for alone at home.
Yeah, it's amazing.
With Kelly, it was just the one session, and we was able to get out all that we needed to, and it was quite even straightforward as well. I didn't even expect to call her the next time for a follow-up and for her to say, yeah, everything's great, I'm done, I don't need to see you again. You know, I didn't expect that at all.
My relationship with my nan is absolutely fantastic now. I enjoy going over to see her. I enjoy being with her.
The results from the East Merton pilot were fantastic. So we had a reduction in GP appointments by 33%. And so that meant that we were seeing a reduced number of patients who previously had social issues and we were medicalising. So that was great for us to get. For me, it makes sense. And so it'd be great if we could really get that across the whole of Merton.
I feel a different woman. I really do. And a lot of people have said to me that have known my situation and what I'm doing, that the relief that's gone off my face, it's just phenomenal. When I was feeling low, again, I didn't let my husband know. Now, I actually do tell him a lot more. So, yeah, it's helped me to trust as well, and letting him know what's going on, that I'm vulnerable, which is very hard to let people know. But with the help that I've had from Adriana and the online therapy, I'm learning to let people in.
So I just want to finish off. I mean, that's just one patient. There's so many patients where all have similar stories, and if we can make that available across the whole of Merton, we're going to see a great impact. So that's social prescribing. Thank you.
Thank you so much, Mohan. It's just so encouraging to see that. So we wanted to give you those two examples about great programs that we've been able to commission for people in Merton. And hopefully we've given you an overview of some of the things we've been doing this year and where we're at in terms of our performance and financially as well. So now is an opportunity for us to open it up to questions from those of you who are here. And we've got a roving microphone, I think, that we can pass out. So let's take questions.
Thank you.
Sandra.
Hello. Couple of questions, actually. On page 21, the piece that we've just heard, it said that you've reduced A&E visits by 50%. On page 7, it says that you've reduced A&E attendance by 15% in the last year. I'm presuming that's referring to St George's, but I don't know. It doesn't actually say what trust you're talking about there. This is very much at variance with what Epsom and St Helier are reporting. However, they say that they've vastly increased numbers and they don't understand why, and they've actually got some sort of investigation going on to find out why they've got increased figures. But whatever, St George's only managed to hit the targets for the 4-hour waits in 84% of the cases, not the 95 target and not the old, I think it was 98% target. So they're failing badly to hit the 4-hour targets by a huge percentage, and that's getting worse. The year before it was about 88%. This year it's reported in your documents only 84% are hitting that target. Can you explain why, if, as you say, these falling numbers of attendances, you're hitting the targets is getting worse, not better?
Yeah, so it's a really good question. So the figures that are quoted around the reductions relate to those specific initiatives. So the figure that's on the earlier page relates to patients in those care homes where we've got that enhanced health in care homes initiative going in, and the figures that Mohan quoted related to patients who'd received a social prescribing offer. So what we're seeing is that with those specific groups where we're putting in place that intervention, we are actually seeing a really significant reduction. Now, I think what I would say about the impact on overall A&E performance is that we then know that these are the sorts of things that we need to be doing more of to support people so that they don't need to go to A&E, so that we can help support the A&E departments to only be seeing the people that they really need to. So I think although we continue to have challenges, a lot of systems nationally have challenges around that A&E performance, we know that as well as the hospitals needing to address that with our support, we need to continue to do these initiatives out of hospital because we know that they can help to reduce pressure on those departments.
Okay, I mean, a subsidiary to that is how do you expect to improve these target 4-hour wait times and ambulance wait times and cancer referrals and all those things if your other part of your other hat is to remove acute services from our 2 major acute hospitals? How can you possibly improve the service and the target times when you're talking about removing acute services from 2 major acute hospitals in our area?
Because we're not reducing none of the proposals are about reducing the capacity of acute services. So we will maintain the capacity in A&E. It's just where it's located might, in the different options, change. I think one of the key things, though, about the A&E performance is about how many of those patients get through A&E in the 4-hour window. The thing about the Improving Healthcare Together programme is it does 2 things. One is it creates urgent treatment centres. So some of the people who are currently going through A&E, who can be dealt with much more quickly through an urgent treatment centre, will be able to go to the right place and get dealt with more rapidly, which takes the pressure off the main A&E. The other thing is because of the proposals are about consolidating the consultant workforce onto one site, you'll be able to get the right level of A&E doctor presence and medical doctor presence in A&E so that patients who attend A&E will be able to be dealt with more quickly because they'll get senior input and opinion much earlier in their journey through A&E. So actually the proposals should improve our performance rather than make it worse.
Even though you intend to halve the number of paediatric consultants and obstetric consultants, you still say that they'll get better service?
I don't think there's a plan to
Well, it's in,
halve the number of
it's in the
consultants.
Improving Healthcare Together document. You have something like, I forget the numbers, 14 consultants in paediatrics. You need 26. No, you need 26. You want to only have between 12 and 14. Some figures like that. It's in your own document.
I mean, I think we can go through that with you afterwards. We're not planning on getting rid of any
I've been asking the same question
consultants.
for a couple of years now, and no one's explained it to me.
Okay, we'll have a go again at the end, I think.
Thank you. But I think the general public need to know the answers to those questions too. My second question, and I have asked it of CCGs individually, other CCGs, how do you feel about the sale of 20% of Epsom Hospital, one of the hospitals you send patients to? They've sold 20% of their land. They were offered 40 million for it. They accepted 18.5 million. They said they'd made £15 million profit to reinvest in the hospital. Now it seems they've only made 11.6 profit from the sale of a fifth of Epsom Hospital prime land. How can that be justified when the population's growing and increasing health needs? How can you condone the sale of a fifth of a hospital for a financially unsound figure when it's going to cost you more to re-provide what you've lost than the money you've made in profit from the sale?
So, Sandra, I tried to respond to that at the governing body meeting last week, but I will hand over to James Murray and see if you can do a better job than I did then.
Well, as I said before, I can't comment on specifics in those individual cases, but every hospital has to develop a service strategy and a state strategy. It needs to maximise the use of its estate because that gives us the best value for money off that. And obviously when it's preparing those strategies, it looks at its forward requirements. So every trust is required to do that. It's beholden to us as an NHS to make sure we maximise the use of all of our assets, and that's what we're doing. But I can't comment on specifics around land sales and values because I haven't got the specifics.
What I would like to check is, I think it's important, if there are other people in the audience who want to ask questions, that you've got the opportunity to do that, and then we can come back to you for more questions or statements. Are there other questions? Do you want to bring the microphone round?
Hi there, I'm David Hobbs from the Merton Mental Health Forum. You mentioned the Trailblazer project. By the end of, 2019, 2020, how many schools do you think will have access to this particular service in Merton?
In Merton, by the end of 1920.
Yeah.
So it will still be probably the 16 by the end of 1920 because of the phasing. By the end of 2021, there'll be the additional schools from the new Trailblazers who are part of that. I've got the numbers in a separate presentation which I can give you, but it's probably roughly another 10 schools. But in addition, in Merton, what we're looking at is through the Trailblazer programme, we get these educational wellbeing practitioners. We are also in Merton funding children's wellbeing practitioners who are very similar. And we're looking to see whether we can use those existing children's wellbeing practitioners to set up a further cluster of schools so that we can take that workforce and use it to support an expansion even further. What we do know is that with the 10 Trailblazers in total and the children's wellbeing practitioners, we will be covering 50% of children and young people across southwest London. So that would roughly apply to Merton as well. We expect roughly half of children and young people in schools to have access to the full mental health support team.
Right, thank you. One other question. You mentioned that there's the potential to merge the 6 CCGs into one CCG. What is the anticipated saving per year of doing that?
So currently the requirement from us to make management cost reductions across South West London is £7 million. So we have to make £7 million cost reduction in our management costs, not in our total costs, in our management costs. And we will make that from a combination of things, and that includes some consolidation of staff into offices, centralised offices. Some of it will be around how we can reorganise our staff to meet the needs of one CCG rather than others, and some will be associated with actually not having 6 CCG. So the total is £7 million.
Per annum?
Per annum, yeah.
Per annum. So Merton will get, what, roughly £1 million of that?
Roughly, yeah.
To put into services?
To put into frontline services.
Okay, thank you very much.
Hi, Beck Yusuf from Health Watch Merton. I think the Trailblazer project is brilliant, by the way. I just wanted to ask, just out of interest, the learnings and the findings that come out, for example, maybe developing a mental health policy strategy for the schools. Obviously, you've got the target 16 schools. Is there the potential capacity to at least share some of those good tools, the guidance, with some of the other schools in the borough? Because I mean, there is, for example, Mitcham Town Community Trust, which is a cluster of 11 schools in Mitcham. And actually, out of interest, is there any schools within the 16 that are in Mitcham? So yeah, that was the general question, actually, Andrew. Yeah.
Yeah, so probably roughly half the schools are in Mitcham, and out of the new wave, it's more weighted towards East Merton. Yes, in terms of sharing the learning, that's a big part of the programme. So within the cluster of schools, the schools amongst themselves are sharing their learning. So actually a big part of the programme is the cluster meetings, where all either heads or the pastoral heads from those schools come together, and that is exactly what they're doing. They're not just sharing policies and developing them together, but they're giving examples of good practice and sharing that amongst themselves. We also get the cluster leads from each of the 6 boroughs coming together regularly, and so you're getting kind of cross-fertilisation from one borough to another, and that's quite good, because in a number of boroughs they've been running existing programmes that they haven't been doing in others, and you're able to see what the impact of those is as well, and how the schools can connect in with some of those other initiatives. The intention is to roll it out across all the schools in Merton, and when we come to do that, we'll have all sorts of things we can share. We won't want them to reinvent the wheel. I mean, there's also a requirement in terms of being a trailblazer that we share that stuff with the national team so that it can be rolled out much more broadly.
Hello, my name's Jiggy. I was wondering whether you had this initiative with just high schools or also primary schools as well? It's
a mix of primary and secondary schools, so it's a really good balance, actually. And it's interesting because obviously it needs a really different approach, and some of the materials and resources have to be very different from primary to secondary schools. Yeah, but it's both. Yeah, and the further education colleges that I mentioned as well. More questions? No, okay. So, well, that allows me then to draw things to a close, but I just wanted to thank everyone from the CCG teams who's worked on bringing today together, but also on all the work that's been done through the year, because actually we've got some really great stuff to present, and that reflects the work of all our teams, not just within the CCG, but our partners in Merton as well, the voluntary sector, without whom we would be nowhere with social prescribing, and the council, who we're working really closely with through the Merton Health and Care Together programme, and increasingly we're joining up what we do, and of course all our mental health and physical health providers in Merton as well. And just a thank you to members of the public as well for coming and for taking an interest in what we're doing. Thank you.